to the Aligned Modern Health Digital Doc Series. We are here today with Dr. Lamia Camel and Dr. Helena Parra from the Aligned Modern Health Acupuncture and Herbal Medicine team to offer an introduction to cosmetic facial acupuncture. Before we get started, we like to give a brief introduction to Aligned Modern Health, just in case this is the first time you're joining us on the Digital Doc Series. Aligned Modern Health is Chicagoland's top-rated health and wellness service provider, offering support for the whole body, both internal and external medicine. We really aim to get to the root cause of why you're feeling what you're feeling and look at you as a whole, complete individual, not just a siloed symptom or condition. We have 18 clinic locations in the Chicagoland area and currently feature telemedicine in 8 US states. We are in network with most major insurance providers and offer complimentary benefits checks and free consults so you can get all of the information you need to feel great about your first appointment. Our clinics are supported by several different core services, including chiropractic physical medicine, which is supported by chiropractic care, injury prevention and rehabilitation, athletic performance support, and clinical massage therapy. Our clinics offer functional medicine and clinical nutrition services, which we like to say is a great way to look internally to better understand why you're feeling what you're feeling externally. We do a lot of evidence-based diagnostic testing to help benefit gastrointestinal issues, autoimmune disorders, bloating, constipation, fatigue, migraines, hormone balancing, food sensitivities, weight management, and nutritional counseling. We round out our services with our Chinese medicine umbrella, which is supported by acupuncture, herbal medicine, and some other modalities under that umbrella like cupping and moxibustion. This practice is amazing to benefit physical pain, but also serves some more intangibles like stress, anxiety, depression, sleeplessness and insomnia, seasonal allergies, men's and women's health and hormone balancing, fertility and pregnancy support. And this practice is also the practice that we are starting to share cosmetic facial acupuncture services. At this time, it is my pleasure to welcome Dr. Lamia Camel to the conversation.
All right, thanks everyone for joining us today. Just a brief introduction of myself. I'm Dr. Lamia Camel. I'm the Director of Acupuncture here at Aligned Modern Health. I work as faculty member at one of the largest schools in the country here for Chinese medicine. So I teach evidence-informed practice and really, understanding research and research literacy and utilizing it in the clinic. I have my doctorate from that same school and my master's there as well. And before I got there, I spent a few years studying Chinese medicine in the form of chemistry and physics. And so let's pass it on to Dr. Parra.
Thanks, Lamia. I'm Dr. Helena Parra. I am the Associate Director of Acupuncture, so I work really closely alongside Dr. Camel to help strengthen our whole team and bring new modalities and new things to our practices, such as cosmetic facial acupuncture, which we'll be talking about shortly. I received my doctorate and my master's from Pacific College of Health Sciences here in Chicago. Before that, I had a similarly more strict scientific life, just like Dr. Camel. I came from a bachelor's in molecular and cellular biology. My practice started out working a lot on anxiety and depression, insomnia. It evolved into more women's health and fertility, and it has evolved yet again into more of a cosmetic focus lately, which I'm super passionate about and really excited to talk to you guys about today.
Awesome. All right. Well, I'm so glad everyone's here. This is a passion project that is a few years in the making. So I'm really excited to bring it to the larger community. So I wanted to spend the time today really just chatting with Dr. Parra and sharing some ideas about this aspect of Chinese medicine. So I figured let's start out with a really simple question, which is, what is cosmetic facial acupuncture and how is it similar? How is it different from Chinese medicine that we generally practice?
Yeah. So like Dr. Camel said, that's a really common question we get. And the simple answer is that it's acupuncture done in the face, but it's a lot more than that, right? So, in Chinese medicine, we're always focusing on the whole system and we're looking at the person's, lifelong experiences, how they're kind of coming together to impact how they're feeling and what kind of symptomology they're experiencing. And so in that same thread, it's a whole system approach to treating the face, right? We'll still be treating any kind of systemic concerns that you have, but we're looking at it through a lens of how it relates to what shows up in your face and your skin, but also how things in your face and your skin are going to be impacting you as a whole as well. So your acupuncturist will always do a full assessment and figure out, what other things do we need to work on? Is there insomnia? Is there anxiety? You sort of can't treat the face as a standalone without addressing those underlying conditions. And, from more of a biomedical perspective, we're stimulating the blood circulation to the face. That's going to help support the skin. We're looking at the musculature, the nerve and blood supply, and how all of that's going to sort of bring out the best in your face. So it's a very subtle, non-invasive treatment. And we're just really looking to balance, to bring vitality to the face and bring out the best in what you already have.
Yeah, I love that point about how, cosmetic facial acupuncture is not a standalone treatment. It's really part of a larger framework of health. And really, the face is a reflection of your health, just like many other things are, right? So why not treat that to treat the internal and vice versa? As we continue to treat the internal, we're going to see reflection of that on the face as well. I love that. So how does it work? What exactly are we doing here?
Yeah. So, acupuncture is going to be working at both the superficial and the deep layers of the face. So really, depending on what's going on, we might be looking at, nerve supply. If there's something neurological going on, is there loss of function, loss of sensation? You're looking to increase local blood flow, which is always going to nourish the skin, nourish the collagen, the elastin, and build a better lattice structure under the skin that's going to help hold things up, right? Help to kind of slow and prevent those wrinkles from happening, or, hopefully we catch them when they're still like thin and superficial and we could erase them altogether, right? Or slow them down a little bit at the very least. And you're also minimizing any inflammatory processes, right? So kind of coming back to that idea of treating the whole body, anybody who's ever had any acne knows that it's not enough to just treat that zit, right? It's coming from somewhere else, whether it's your gut or your hormones. If you're not addressing that root cause, then you're probably just going to end up back in the same place.
Yeah, and that really shows up in how we treat, right? We're not just going to be putting needles in the face. We're going to be treating systemically as well, because it's really that tandem that works most successfully. Yeah. I like the idea of treating deeper in the face to see the reflection, at a more superficial level as well. I think the face is just it's a reflection of who we are and where we're at this moment, right? I have a 4-year-old, and I think that kids at that age are just so expressive, and right away like what's happening internally. But we're the same way even as adults, and so when we see these lines on the face, I think it starts to give us an idea of what's their emotional state in general, right? What kind of things do you see from that perspective?
Yeah, I mean, there's areas in the face that you're going to be holding more tension, and we sort of think about the visible part of it, right? We look at the wrinkle, but we're not really thinking about like the musculature that's behind the wrinkle, right? Like, where is there tension? Is it enough to just treat that wrinkle, or do you need to kind of go deeper? Do you need to treat the corrugators, right? Those muscles that are going to be furrowing your brow, but let's go even deeper. Do we have to treat the lifelong frustration or irritability, right? That's leading to you always furrowing your brow. So that's kind of how we start looking at things on many different layers. And, we can start to release a lot of emotion through the face as well, which I know Dr. Campbell's really passionate about talking about as well.
Yeah, I think that's what got me most interested in it. I mean, I think the vanity piece is important, right? We want to feel confident in who we are. But the fact that, it's another way to let go of things that we've been holding on to through simple, tiny little needles in the face is just fascinating to me. We're always working to process through things, and to know that some of them can be stuck in the face, and we can just pop a few little needles in there and release it is just so cool to me. And not that I want my patients to cry, but if they need to cry, I want them to cry, and let's move forward, right? And then suddenly you start to release that tension that you're holding, and you start to see that person that was there before, right? That transformation is just such a beautiful thing to me. So that's why I really dig it. And people feel good too. You can't go wrong with that.
Yeah, I think that even before like the skin starts to change, people feel different, right? They look at themselves a little bit differently. And sometimes you're only 1 or 2 sessions in and people are like, I don't know what it is, but I just feel so much better. My self-image is better. I feel like, like your spirit is really coming out through your face. A lot of people think that physical pain and tension kind of stops at the neck and shoulders, but all those muscles feed into your face, right? And you got to kind of treat both to help things to really start to open up.
Yeah, that was one fascinating thing when we started this training together a few years ago was just how much the impact of neck and shoulder tension can have on the face. And then as I was thinking more, I was in medical school for a couple of years and we did gross anatomy and we did cadaver lab and we looked at the musculature, but we never discussed the fact that all of the muscles are connected to each other in the face and they're not necessarily connected to bones in a way that's totally unique. And when you think about it, well, why is that the case? I always like to think about why did were we created this way, right? Why did we develop this way? When you think about it, it gives us so much more flexibility. And in that flexibility allows us to heal ourselves faster, right? And release things better, but also express ourselves more, right? My shoulder doesn't express the same way my face does, right? I love it.
Yeah.
Okay.
Go
So I was
ahead.
going to say, what kind of things you can see we hang out with each other frequently, or like we fill each other's sentences. Tell me, what kind of things do we generally treat? What kind of things are you treating a lot of?
Yeah, so I think that one of the things I love so much about cosmetic acupuncture is it's really bringing out the best in what you've already got, right? So it's just trying to sort of clean up and enhance your natural features. It's not really changing the face very much. So it can certainly be subtle, but it's also really highlighting you. But some of the things in particular that we treat are prevention and slowing the signs of aging, softening any fine lines and wrinkles. Like I mentioned earlier, you're also looking at like tension held in the musculature behind those fine lines and wrinkles, right? Like sometimes people have pain, neuropathy, all those things can be treated through cosmetic facial acupuncture. Things like acne, sunspots, melasma, any scarring, evening the skin tone, evening the texture of the skin, fluid retention, right? We have a couple too many drinks over the weekend and then suddenly we're puffy for a week. Things like gua sha and acupuncture are really great at moving that stagnant fluid out of the face, which really, if you leave it there for a long time, that could lead to acne too. And it's going to improve your physical and emotional health, and it's going to improve your self-image quite a bit.
Yeah, I love the preventative aspect of it as well. I think we often spend, we spend a decent amount of money on products for our face and all of those things. But just adding this to the equation can really maximize and highlight the value of all those other things that you're doing as well. So whether it be, more on the surgical side of things or just using a really high level oil or lotion, or if you already have a gua sha routine that you use, this really ups the game, which I think is so cool. One other question I frequently get is, what does treatment look like? So usually the questions come from folks who are already getting acupuncture, so they already have a sense of kind of what we're doing, what the process looks like. But can you kind of walk through a little bit how cosmetic is a little bit different or really similar as well
Yeah.
to standard acupuncture?
So like we mentioned earlier, we're always looking at treating the whole body. So like we would in a regular general acupuncture session, we're going to get a medical history. We're going to sort of talk about, any signs and symptoms that you experience on a day-to-day basis, really from top to bottom, right? Every system gets discussed. And as far as treatment, I always still treat the full body first, right? So like anything you would be getting at a regular weekly acupuncture session. But then we get a little extra on top, right? Then we're really starting to look at the face, assess the musculature, assess the skin. Usually I'll cleanse the face. I'll do a little bit of facial massage, some gua sha. Those tools really help me. Well, they feel wonderful for the patient, right? And they're already starting to get things moving, but it helps me assess what's going on beneath the surface as well, and kind of where the areas of tension lead and where I need to treat. After which we'll do the facial needles. You rest with them in just like you would with regular acupuncture. And after we sort of remove all the needles, we do another little cleanse, some moisturizer, some serum, usually some hyaluronic acid to close things up and we send you on your way. We also always take pictures kind of at the beginning, the middle, and the end of our planned treatment course, just so that we have some great baselines and some physical proof of how things are changing.
Yeah, I love that one point you mentioned about how when we're doing the gua sha, or we're applying the moisturizer, that we're using that diagnostically as well. And that's one of the things I love about how this parallels other things that we do in Chinese medicine, like cupping, where the treatment is actually diagnostic as well. So as we're treating, we're diagnosing further and giving us more insight into why these wrinkles are there or why there's this tension there. Again, it's there's a reason. Yeah. So that's where there's always a reason, right? So that's where the questioning really comes in. And I love that we still do a full health history, because we need to know what's going on in your life. We need to know what you're putting into your body. We need to know what your body is experiencing every day, because that is going to be reflected in your body, like it or not. And it also doesn't have to define you, right? So helping folks process through that through their bodies is what we're doing. And the cosmetic facial part is just like a cherry on top, if you will. Not like a super sweet cherry, right? More like a bourbon soaked cherry. So some questions, another question I get is from patients who maybe are doing other types of treatments, and they're asking about, kind of how this fits into that continuum of, if maybe they're doing Botox already, or they've done it before, or fillers or anything like that. Can you talk a little bit about kind of how we intersect with that?
Yeah, I think that, somebody who's coming in to do cosmetic facial acupuncture should be aware that, we are working on a lot more subtle layer, right? So while we can make pretty impactful changes and really enhance your face, if you're looking for something that's going to modify or give a little bit more of a dramatic change to your face, then that's not really where cosmetic acupuncture is going to shine, right? In that case, Botox or filler really might be the way to go, or some combination of both. And I always like to make sure people know that you don't have to choose one route and stick to it. You can certainly use both to kind of customize and suit your needs the best. Maybe there's certain areas where the wrinkling is really deep and we'll get it down 50%, but maybe you want to get that last 50% or that last 10%, kind of improvement. So you might elect to do some Botox or filler. Important rule of thumb is just to always space treatment out accordingly. And any acupuncturist you're working with will pretty much usually ask you, right, have you had recent Botox or filler? We don't want to alter or, kind of change the way that those things are going to work, because you're paying good money to get those put where they want to be, right? So you need to let those things sit for about a week before you resume, which is usually easy enough to work around.
Yeah, I love this, very similar to how we practice acupuncture in general. This is a complementary medicine. So it's not uncommon that we're going to be working alongside other treatments, right? Most people come in and they're already taking some pharmaceuticals. And so we're going to work alongside that, and we're going to complement them. Our education is such that we understand how those things impact your body. And so we know what we're going to do and how that can shift things, and, what to stay away from, but also what can actually benefit whatever else you're doing as well. I think that's a really important piece of this puzzle is that complementary aspect, right? We work, we're always going to meet you where you're at, right? There's no judgment. This is your body, right? We're here for the ride with you. We're here to give you expert insight. And that actually, that brings up a question that somebody had brought up about, do all or most acupuncture providers offer this type of service? So it is actually a specific training that has been done. There's varied amounts of training that folks do, but Dr. Para and I did a year-long coursework, and then we distilled that into coursework that we then taught our team. And so not everyone on our team has been certified yet. It's kind of based on interest, but most of our clinics have someone there who has been trained and certified, and we've done work with them directly, and they're getting continuing education with that, and are passionate about it and excited to do it. So it's not necessarily part of kind of the standard training that folks get as in acupuncture schools. It's more specialized training.
Yeah, I think one of the really special things about the type of training that we did is we got to study with basically all the heavy hitters in cosmetic acupuncture in the acupuncture community. And we had the opportunity to study a lot of different styles and see where people sort of piece things together from, and then create something totally custom on top of it, right? And while there is the same training between all of our providers, the beauty about acupuncture is that it's a really artistic practice, and people can really fit things to uniquely suit your needs. And so it might look a little different practitioner to practitioner.
Yeah, yeah, I did love that about our training, is that we really did learn so many different styles that give us, so much more flexibility based on who's walking in the door. But also, it's not uncommon for folks to do kind of a weekend course with one teacher and then, start practicing this. So we really wanted to go above and beyond that. I'm a proponent of representing the medicine in the best possible way. So we chose this coursework, and it was just, for us, I think it was just so much more interesting to see, such totally different styles. And you're right, you find what resonates with you, but also it resonates with your patients, right? One style might be too aggressive, one style might be too, delicate. And so you kind of get to play with those until you just see what works perfectly for them.
Yeah.
Talk to me a little bit about, how we communicate care, what do we, setting expectations, that kind of thing. What does that generally look like with cosmetic facial acupuncture?
Yeah, I mean, with all acupuncture, right, dosage is super important. With any medicine, that's true, right? If your doctor prescribes you an antibiotic, you're not going to go home and take it once and expect to be healed, right? They tell you you're taking it once a day for 2 weeks, you're going to listen. So similarly with acupuncture, the frequency and duration of treatment are going to be kind of customized based on the things that we're working with. Usually for cosmetic and facial acupuncture, once a week is the cadence that I like the best. I think that gives the skin time to sort of potentiate the treatment and really kind of regenerate. And then you kind of see what you're working with the following week. Typically 10 sessions is what I recommend. Somebody with like really advanced concerns might need a little bit more treatment than that. But certainly that 10 sessions, 10 weekly sessions, we'll start to see a lot of change. And for a lot of people, that'll be sort of enough to start to back off to maintenance treatment, which, depending again on what's going on, could be about once a month, could be every other month, every 3 months even.
Yeah, I think that cadence is really important for sure. And there's a lot that gets handled in those 10 visits,
Mhm.
but having that consistency is pretty important for sure. So I love seeing folks consistently, because they start to, like you mentioned earlier, even before things start to really make huge shifts in the face, they feel more open, right? The face in Chinese medicine, the face is the first line of expression, and quite honestly, in allopathic medicine as well, right? It's our faces that react first, and when something bad happens, kids look where? At your arms? No, they look at your face because they know, right? Or animals do too, right? They're smart. And so how we address that, as we're continuing to treat folks, and as things start to develop, what you'll find is that the underlying will start to shift. As Dr. Parra mentioned earlier, I can think of one patient who tended to be quite reserved, and after just a couple of treatments, all of a sudden was like, yeah, I'm going on dates now, and like I put myself out there. It's like, what? Are you kidding me right now? Like, this is such a dream for both of us, because I've been treating her for a while. So to see that shift just by just releasing some of that tension, that wall maybe that she was creating between herself and the rest of the world, was so cool. You can tell that's what I geek on. What kind of, maybe, do you mind sharing maybe one of the exciting kind of things that you've seen with your patients? Any?
Definitely. I had a recent case actually. There was a mix of things that we were working on, and some of them I was a little bit more familiar with working on. I've always found melasma to be quite resistant to treatment, and depending on the skin tone, kind of the severity of the spots and how long they've been around, that'll dictate how well they respond. And so I sort of set this patient up, to know like, hey, we're going to do what we can here, but these spots might be really resistant. They might take a while. We were both shocked to see how much they changed. And this was a particularly sensitive patient. So I used even fewer needles than I typically do. And I was like, oh, it's really limiting me. Where are we going to get? And the spots were more or less gone by the end of 10 treatments, which, I thought I was going to be referring her out to some laser afterward. Right. But really, that kind of goes to show how this can really be an alternative sometimes, right? So some people will want to use some more medical aesthetic treatments in addition to cosmetic facial acupuncture. Some people will be able to just use cosmetic facial acupuncture, especially people who are maybe a little bit more wary of injecting things into their body, right? It's a great alternative.
Yeah, absolutely. I think it can do both, just like Chinese medicine in general, right? It's not uncommon that we're going to be complementing, when we work with our fertility patients, we'll work with them as they're going through assisted reproductive therapy, but we'll also be their main source if they say, you know what, I just want to try to regulate my cycle and get pregnant and do it the old fashioned way. And if it doesn't work, then let's try something else. So you're absolutely right. I think that this is a choice, and I think we do both really well. In general, that's just how beautiful this medicine is, right? And cosmetic facial acupuncture is just another example of that. We have another question here about chronic sinusitis and frontal face pressure, headaches, and if we help with that, neck and shoulder tightness. We treat this. I'm in the clinic today, and I would say about 70% of my patients today have some sort of neck or shoulder tightness.
Yeah.
And we're seeing some solid progress. And then, of course, this time of year is very much the sinusitis, headache kind of time of year. As the weather shifts, it gets warm and it gets cold. We see a lot more of the sinus pressure and congestion in the face. So certainly, just with standard acupuncture, we see a great effect on this. There's some solid research to support the use of this, international research, not just here in the States. But I'd love to hear, how you see this with cosmetics specifically, Dr. Para.
Yeah, as you mentioned, those are some concerns that you could treat with regular acupuncture, not even using cosmetic facial acupuncture. But I think that treating those things is going to be necessary to treat the face as well, right? If somebody's got some neck and shoulder tension, if you're not resolving it and opening those things up before you start working on the face, it's going to really limit how much progress you can make.
Yeah. I mean, at a very simple level, if, everyone here, if you're in Chicago, then you deal with traffic at some point. I take my son to school at the worst possible time during the day, so I get to experience this every morning. And you know what a bottleneck is, right? And our necks are the same thing. So all the vasculature, all the fresh blood is coming from our heart. It's going to go up to our face. So if this is tight, if there's constriction in here, it's going to impact our faces, like it or not. And it kind of blew my mind when I heard that. I was like, why is this so shocking to me? But of course it is. So, if we see that tension in the neck and the shoulders, it will absolutely have an impact. And so not only can it impact blood flow from the perspective of, life in your face and freshness and collagen and all of that, but it will absolutely impact, your body's ability to drain out that inflammation, right? And so, releasing that tension first is generally what we do. We're going to go and soften up the neck, maybe do cups, maybe do gua sha, needles, depending on, the situation and what's going on with you particularly, and what's going on with you that day as well, right? That's how personalized it is. Then once we release that, we can start getting that, we can start signaling the brain to send fresh blood to that area by putting in these tiny little needles. So, the chronic sinusitis piece is a really important thing that we see very frequently right now, and where I think cosmetic can have a huge impact is the facial gua sha that we do, and the cupping as well, right? So, and you see it, if you have this, if you, when you've experienced it, your face feels puffy, right? Sometimes it even feels kind of hot and red to the touch. And after we do some cupping or gua sha, again, depending on what's going on with you, you see that extra fluid kind of dissipate. You see that redness start to dissipate before we even put in needles. So it's pretty cool. And I love to teach my patients to, this is at home routine you get to do, right? Here's your homework, because we're just here facilitating the process, but this is your body and this is your life, right? So I like to teach people, what they can do at home to empower themselves as well. All right, I think we have a couple more questions here I want to make sure we answer. So someone asked about, what would you treat with acupuncture versus Botox? Can you do both?
Yeah. So I always like to use sort of 11s as the best example, right? Because everybody's trying to get rid of these pesky wrinkles between the eyebrows. And acupuncture and Botox are just coming from sort of a different perspective in treating that. So from a Botox perspective, you're looking at freezing the muscle so that you're not, wrinkling the skin and creating that fold. And so, it's really great at kind of getting immediate dramatic results in the short term. But as anybody who's done Botox knows, you kind of have to continue doing it to keep having that effect. The approach that acupuncture takes is more about looking at the scaffolding or the foundation below the skin, right? And thinking about why there's that breakdown of collagen elastin that's not holding that skin up. Kids furrow their brows too, right? And they don't have 11s, but we do. Because as we get older, we have weaker circulation, right? We don't have as much collagen and elastin coming to the area. And so if you're really supporting that circulation, that collagen, the elastin, the musculature, the nerve supply, then you're just building kind of a better foundation to help hold that skin up. So you can kind of work more superficially in the wrinkle, but then you're also working from underneath to help kind of fill that area in.
Yeah, I like to think of it at a very simple level of, are you band-aiding the problem or are you treating the root of the problem, right? And look, band-aids are necessary, right? You cut yourself, put a band-aid on, please, yes. But if you really want to treat the root of it, that's what we're getting at when we're treating the body. And again, this is how cosmetic facial acupuncture differs from maybe other facial acupuncture, where you're just kind of putting a bunch of needles in the 11. So that's great, right? It's going to loosen up that muscle, just like if you put a bunch of needles in the shoulders, it's going to loosen up the shoulders. But are we really getting to the root of the problem there? I would say no, right? And that's where we're really treating the whole system to make a shift. One last question was about how this differs from microneedling. It's a great question.
It is a great question. I am a huge proponent of microneedling. I really, really love it. And it creates really wonderful results. The thing about microneedling, though, is that you're working only at the surface, right? So those tiny needles are really only accessing the epidermis, but below the epidermis, there's muscles, there's fat, there's dermis, there's a SMAS, right? Which is like the neuronal network that's working along the fascia that's connecting the muscles together. So really, it's kind of that same idea of treating just the outward appearance or the surface of things versus treating what's underneath, right? So I like when my patients get microneedling. I often recommend it in tandem, right? Things that are more on the surface, like melasma and sunspots, might respond a little bit quicker to something like microneedling. But if there's any deeper work to be done, and 9 times out of 10 there is, then cosmetic facial acupuncture is going to be the way to go.
I would say 99 out of 100 times.
Yeah.
Yeah. I mean, and that's just generally the case, right? It's rarely, you don't furrow your brow just because, there's something under there, right? But I agree. I love microneedling, and that might be something we bring into the practice at some point, for sure. I think I'm super interested in that, but because it adds like a nice extra to it. So I love recommending it externally. But again, it's more of a Band-Aid. It's almost like a nice serum, right? You're getting, there's a value in it, but it's not going to fix the underlying issue here. So it's a great addition to what we do already. Yeah. Well, with that, I think we should probably pass it back to our webinar mistress here. I did want to say that, we do offer free consultations, and she can go into that in a minute too. If you want to talk to us more about specifics of what's going on, we will happily do that with y'all.
Thank you so much, Dr. Camel. Thank you, Dr. Para. We do have time for just a few more questions if anybody has any. We have some questions coming in about cost and insurance. So as you can see on your screen, Aligned Modern Health is in network with various major insurance networks. Cosmetic facial acupuncture specifically as a treatment is not covered by insurance. However, if we are treating other systems in the body, as both Dr. Para and Dr. Camel mentioned, we can offer a hybrid fee schedule where we are submitting what we can to insurance if you do have acupuncture coverage on your policy, and then offer kind of an addendum for the cosmetic facial acupuncture portion of your visit. If you are coming in for cosmetic facial acupuncture on its own and you are not treating additional symptoms or concerns, which again is not frequent but could happen, that would be at our competitive self-pay rates. We do have several packages available for a full course of treatment plan, which again starts at about 10 visits after your initial session, that do offer cost savings over time. If you would like any information specifically about insurance coverage and or cost, we absolutely recommend scheduling a free 15-minute consultation with a provider to speak with your specific concerns and goals so that we can best personalize that answer for you. Again, since there is a little bit of a hybrid for some of these treatments, we want to make sure we get information that's customized to you specifically and not give a universal answer about that. If you do have any other questions, you are very welcome to type them into the Q&A feature. Otherwise, please know that we absolutely appreciate you joining us here today for this Digital Doc introduction on cosmetic facial acupuncture. You can always give us a call for more information, to request the insurance benefits check and or a free consultation at 773-692-6700, or you can visit us online at alignedmodernhealth.com. I do not see any additional questions coming in, and we are at about time for today's session. So again, please know that we appreciate your time here with us today. Dr. Camel, Dr. Parra, thank you for your time as well. And we hope to see you at future Digital Doc sessions. Thank you so much. Have a great day. Cheers.
Thanks, everyone.